This video is for President Donald Trump as well as RFK Jr. If you're not those people, by all means, stay. We love it when people are a little bit nosy. I saw the document you released a few days ago on February 13th, establishing the president's Make America Healthy Again Commission. And I, as a primary care nurse practitioner, also would love to make America healthy again. I've read it. I have some notes. I have some parts that we agree on. And I wasn't sure after I looked it over if you had the chance yet to have someone who works in primary care as a healthcare provider sit down and discuss the document with you. We are very busy. We have a lot of patients. It's wild out there. But I happen to have today off, and I thought I would offer you those services. I would review it with you, give you some feedback, and go from there, because there's nothing that I would love more than to see people be healthier. That's literally why I do what I do. Also, I know you guys are very big into government efficiency, all about that. And I saw you gave yourself 100 days to figure out some of these problems. And I just want to reassure you, I really can help you out in this area. I've solved most of these things in a couple of hours, just looking at some data that we already have. And what's not more efficient than looking at data that we already have to solve problems that are right in front of us? So this is really becoming a better and a better day for you. And I hope you're as excited to look over this as I am. I also just feel like I should level with you just so you know where I'm coming from. And I would love to know where you're coming from with some of these things. If I had my way, you probably wouldn't have been the people I hired for this job. So that bias might come through sometimes. However, in my years in healthcare, have worked with a lot of people where I was like, oh, you would not have been who I would have hired for this job. And we made it work, right? We tried to learn something from each other. We got through it. And I think we can get through it. All right, let's just jump right into this document, okay? Establishing the President's Make America Healthy Again Commission, again from February 13th. Section 1, purpose. American life expectancy significantly lags behind other developed countries, with pre-COVID-19 United States expectancy averaging 78.8 years, comparable with countries averaging 82.6. Not ideal, right? I want people to live longer too. We're starting out strong. This equates to 1.25 billion, with a B, fewer life years for the United States population. 6 in 10 Americans have at least one chronic disease, and 4 in 10 have 2 or more chronic diseases. And I see people all the time who have a lot more than 2. Again, I see the problem here, and I agree we should work on fixing it. An estimated 1 in 5 United States adults live with mental illness. And if we're being honest, guys, I think that's probably something that might be a little bit underdiagnosed. We have a huge problem, if you didn't know about it, with mental health services where not enough people can access them. I have dealt with this as a primary care provider, like in my own life. And if I'm having trouble accessing mental health care, I would imagine most people who aren't as familiar with our system that can be complicated would be having a hard time. These realities become even more painful when contrasted with nations around the globe. Across 204 countries and territories, the United States has the highest age standardized incidence rate of cancer in 2021, nearly double the next highest rate. Further, from 1990 to 2021, the United States experienced an 88% increase in cancer, the largest percentage of any other country evaluated. Yikers. So obviously, that's not good. There's a saying that we have in healthcare, and it says, when you hear hoofbeats, think horses, not zebras, saying, think of the most obvious solution first, right? The most obvious diagnosis. The biggest comparison, if you look just at our country and other countries, what's the biggest comparison and difference in our healthcare? So we have privatized healthcare, and other countries have universal healthcare. So I'm willing to bet that would be my eggs in my basket that a lot of the reason why we have increased cancer rate and all these chronic conditions that are at an increased rate is because people can't access the healthcare, especially earlier on when we can help prevent and reverse a lot of these chronic conditions. They can't get in to see people. And I see that played out every single day in my practice. When people come in, they can't come back for follow-up appointments because they can't afford it, or they put it off for years, and then they end up addressing it in the ER years later because they couldn't afford those initial visits. So I think number one, if we incorporated more of that, having a more accessible healthcare system, that's going to solve a lot of these problems. But let's keep reading just to reinforce a lot of that. Oh, I also was looking at some ways that we could reduce cancer in itself. And it's not just me spitballing here and saying universal healthcare would be the solution here. There is a study, the Global Burden of Cancer-Associated Risk Factors in 2004 countries and territories. I wonder if this is actually where you pulled your data from. It's from the Journal of Hematology Oncology. I will link it down below if you want to take a peek at it, but I think it sounds like you already probably have it. And they found a few things in this study. And one of them was that it was really important that we have gender equality in healthcare, right? They actually found that more women have cancer, but men went to go get treatment for it less, so they died more. So there needs to be good, both like scooping up and diagnosing, as well as getting you through the treatment part of it. That's really important. So we really should focus on a lot of that equity. I did notice you pulled back a lot of DEI things recently. So maybe we would reevaluate that, right? Because we're learning equity is very important in things, particularly like healthcare. Another thing was they found that prevention is going to be hugely important, right? Policymakers should formulate specific prevention and control strategies that reflect the cancer in their country. So really doing like what you're doing, collecting some data, seeing what are the biggest cancers that we have, and then rolling out prevention measures. So in our country, we have a lot of breast cancer, prostate cancer, skin cancer. We should be making sure that skin checks are paid for and available for people. That way we can catch skin abnormalities really early. We can do mammograms, pap smears, labs to check for prostate stuff. All those things, like all the regular cancer screenings, should be widely available at no cost to people, even if they don't have insurance. I think that's what we're getting at, is these should be widely available so we can catch things early, as well as prioritizing like smoking regulation and other carcinogenic risks. So I think definitely we could take a look at how we're regulating smoking, as well as looking at carcinogenic risks. And a lot of that stuff is in your environment, right? And so I think one thing would just be to really make sure we're supporting efforts to regulate environment, make sure our air quality is good, make sure we're going into supporting public health so that they can make cities and water and all of that as safe as it possibly can be. So big takeaway there immediately is one way we can reduce cancer would be by making healthcare accessible to everyone so they can get early detection, which we know saves lives. Let's go back to your document. In 2021, asthma was more than twice as common in the United States than most of Europe, Asia, or Africa. So let's take a really quick look at what the biggest risk factors for asthma are. Family history. Can't do much about that, can we? Allergies and viral respiratory infections. Those are going to happen, right? Occupational exposure. Let's make sure, again, public health we're doing the things that we need to do to try to make those exposures minimal. We're funding the research to make processes safer. We're doing all the things to keep people safe where they're working, right? Smoking. Okay, that's causing a whole lot of it. Let's see what we can do to reduce that. Let's see if we can start programs that will help people quit and really go in there. A lot of that, again, just funding healthcare in the primary care sense so that we can have time to educate patients about smoking cessation and different behavioral management, things like that. Air pollution, again, so funding things to help reduce environmental impacts, and obesity. So again, primary care here is huge. So we can provide education about balanced lifestyles. We just don't have a lot of time to do that in 15-minute appointments. So I think this just goes back to if we really ramp up our primary care, we would be able to address a lot of these things and even talk to patients about how we would reduce it. Going back to your document, autism spectrum disorder has the highest prevalence in high-income countries, including the United States in 2021. This was interesting that you threw in here because you threw that in there with cancer and asthma, which are like cancer and asthma are diseases and illnesses, and autism is not a disease. So I thought it was slightly alarming to me. I think we categorize things, maybe you and I, a little bit differently. You were almost saying, it sounded like you were saying that us realizing like neurodivergence might be more common than we thought it was is like a bad thing, when really that's just saying like the way someone's brain was made is bad. And that, to me, that ruffles my feathers a little bit. So I hope that you reframe how you think that, because people with autism are not broken. Their brains just work a little bit differently. And then you follow it up with this line: similarly, autoimmune diseases such as inflammatory bowel disease, psoriasis, and multiple sclerosis are more commonly diagnosed in high-income areas such as Europe and North America. And you're kind of just throwing that in there with all those other chronic disease and illnesses. And it's not a chronic disease or an illness. So just a learning point for you. It's okay for people's brains to be just different. Overall, the global comparison data demonstrates that the health of Americans is on an alarming trajectory that requires immediate action. Again, aside from the autism issue, I agree that we do have a lot of chronic illnesses that are really just tanking into the ground. It's taking a pretty big hit on a lot of primary care providers as we see it going down in flames, but we can't really do a lot about it. So again, if you could fix the insurance issue and the 15-minute appointment time so we could actually do our job, would love it. Okay, this concern applies urgently to American children. I also agree. I see a ton of kids, and I do not have enough time to educate their parents on all the things that I would love to talk to them about. So I'm here for this. In 2022, an estimated 30 million children, 40.7%, had at least one health condition, such as allergies, asthma, or an autoimmune disease. I haven't fact checked that number, so I don't know if that's true or not. A lot of kids do have a lot of stuff, and yikers, maybe someone else fact checked that, but ooh, is that true? That's a lot. Autism, see, we're going back. Autism spectrum disorder now affects 1 in 36 children in the United States, a staggering increase from rates of 1 in 4 out of 10,000 children identified with conditions during the 1980s. So again, I'm just going to remind you, not a disease. However, you're right. There is more autism being diagnosed, but I wanted to give you a little bit of an insight into perhaps why, right? So in the 1980s, we defined autism in a very different way than we did now. And the inclusion criteria, so the way you get diagnosed with it, has become broader and broader. The way they diagnose things in psych, as we look at this book called the DSM, we are now on the DSM 5. But every DSM that has come out has broadened what we would diagnose as autism. Before it was very narrow, and now it's a lot larger, right? So in 1987, the DSM-3 came out. That made it a little bit bigger. In 1994, the DSM-4 came out, and that really introduced the concept that maybe autism is a spectrum, and it included even more people on it. And now the DSM-5, it really opened it up, really leaning into like how it's very much a spectrum of a diagnosis. We've learned a lot more about it. We used to really not diagnose girls with it all that much. We've learned, oh, girls can have this too. And as we've diagnosed more people with it, we've been able to provide people with a lot more services, which make living in this world for people who have a brain that works in a slightly different way more manageable, which is only good. So I do have a little bit of a beef with how you kind of threw that in there. I don't think it's an increased incidence rate. I think it's an increase in diagnosis, which just helps us help more people. And again, not an illness. Okay. 18% of late adolescents and young adults have fatty liver disease. That is not great if that's true. Close to 30% of adolescents are pre-diabetic, and more than 40% of adolescents are overweight or obese. Again, if we have more time in primary care, we can talk about those things, make sure people are having balanced, healthy lifestyles, promoting things that they enjoy doing that makes them and their body happy. These health burdens have continued to increase alongside the increased prescription of medication. For example, in the attention deficit hyperactivity disorder, fun fact, it's just ADHD, attention deficit hyperactivity disorder. ADD is an old term, so you can just cut that one right out of there. Over 3.4 million children are now on medication for the disorder, up from 3.2 million children in 2019 to 2020. And the number of children being diagnosed with the condition continues to rise. I do just want to point out that medication is not anyone's first choice when working with any human, adult, or child, but particularly with children. Most of us approach it with immense caution. There probably is more ADHD medicine being given out. One, because we're diagnosing more people. Again, girls. We're realizing, oh, girls mask really well, and we are missing diagnosing them. So girls coming into the population, as well as our education system, is having a hard time. As I'm sure you have heard, class sizes are getting bigger in public schools. And so I think one thing we could do is pour a lot more money into public schools. I'm not going to say pour it into charter schools, because charter schools don't actually do a lot with people with neurodivergent things, and they kick people out as soon as they don't behave the way they exactly want it. That is not usually a friendly choice for people with brains who work a little bit differently. So public school is going to be where we want to spend our money to incorporate different programs to help people succeed, reducing class sizes, giving kids something else they can stand up, bounce, outlets where they can just let some of that ADHD energy go, right? These aren't bad kids. These are kids whose brains just work a little differently. And I think in settings where their brains are allowed to work a little differently and they're supported in classrooms to do that, we do well. And we don't always need meds, right? Sometimes people do need meds, and that's okay. But a lot of times, I'm telling you, I get notes from teachers and parents come in desperate, and they're like, my kid's teacher basically said they need to be on medication because this isn't working and they can't handle them in this classroom. And that's what we do. So if we could help support schools supporting these kids, I really think that would help reduce the amount of times we have to prescribe medication to kids to help keep them behaving in a classroom. You know what I mean? So more money to schools. Got it? Let's keep going. This poses a dire threat to American people and our way of life. 77% of young adults do not qualify for the military based on a large part of their health scores. Does that worry you? I bet it does. 90% of the nation's 4.5 trillion in annual healthcare expenditures is for people with chronic and mental health conditions. In short, Americans of all ages are becoming sicker, beset by illness that our medical system is not addressing effectively. And these trends harm us and our economy and our security. I agree. We spend more money per capita, so per person, on healthcare than all sorts of other countries that are like our comparables, right? That we usually look at. And our health outcomes are way worse. Okay. We're wasting a lot of money, a lot of healthcare money dealing with insurance, how to process insurance, how to fight with insurance. We could save a lot there if we cut out that middleman. Just saying. To fully address the growing health crisis in America, we must redirect our national focus, its public and private sectors, towards understanding and drastically lowering chronic disease rates and ending childhood chronic disease. I am sometimes told that I am an optimist, but I must applaud you here. You are going to end childhood chronic disease. Nothing would make me happier than to see the day when we end childhood chronic disease. I admire your enthusiasm, and I'm excited to see what you have in store. This includes fresh thinking on nutrition, physical activity, healthy lifestyles, and over-reliance on medication and treatments. I'm with you. I think nutrition, physical activity, healthy lifestyles, and again, we don't want to rely on medicine. We're there with you. It almost feels like you're attacking things when you say like an over-reliance. I don't think anyone goes into work being like, I can't wait to see what medicines I can prescribe for people today. We'd love to do it other ways. If you would just give us the time to do it and work with people a little more, I think we could reduce some of that. So if you could sound a little less like attacky and judgy, I'd love that. The effects of new technological habits, environmental impacts, and food and drug and quality and safety. I also am concerned about environmental impacts. Oh boy. So hopefully we can address that, and food and drug quality and safety. Agreed. I'm with you on that one. That's a great point. We must restore the integrity of the scientific process. Yes, by protecting expert recommendations from inappropriate influence and increasing transparency regarding existing data. I am a little baffled to hear those words come out of your mouth. Both of you, especially. Just some things I've heard have been like odd, but I'm glad you're recognizing that within yourself, that maybe we can improve on these things and change and stop spewing things that are not based in science. I'm just thrilled with that. You want to make sure that what people are saying is actually based in science. Social media will never recover. We must ensure our healthcare system promotes health rather than just managing disease. That is literally what primary care is set out to do. So I am thrilled. I'm honestly just thrilled with most of that paragraph. Well done. Section 2 policy shall be the policy of the federal government to aggressively combat the critical health challenges facing our citizens, including rising rates of mental health disorders. Again, promote easy access to mental health services. You got it. Obesity, diabetes, and other chronic diseases. Promote time in primary care so we can help people before these things get bad. To do so, the executive departments and agencies, why does it say agencies and then parentheses agencies? Typo. It's fine. It's totally fine. Just chop that one out. That address healthcare must focus on reversing chronic disease. Let's do it. Under this policy, A, all federally funded health research should empower Americans through transparency and open source data, should avoid or eliminate conflicts of interest that skew outcomes and perpetuate distrust. Let's go. Let's say who's funding the research? Where are you getting this data from? What does it actually mean? I'm all for it. I hope you also have good people to interpret it who really are able to just be like non-biased and tell us what it really means, because that part's really hard. Because right now, a lot of people think they know how to read articles, and trust me, I suffered through a lot of classes to learn how to do it, and I'm still not overly good at it. So I think we could improve on that as a whole, and having them be like less skewed and biased already. That's great. Because how many people do you know, right, that you're going in there, oh, I have found this article. And you look at it, you're like, that article is garbage, but they can skew it any way they want. So unskewing it, love that idea. B, the National Institute of Health and other related research funded by the federal government should prioritize gold standard research on the root causes of why Americans are getting sick. Great. A lot of randomized controlled double-blind studies. Perfect. Excited for it. Those aren't like always possible. Sorry, I have a hair on my eye. Oh, heavens. Those aren't like always possible just based on the type of data you're trying to get. But doing that, looking at meta-analysis, beautiful. Let's do that. I am all for the best research. I hope you are funding it flawlessly, beautifully, giving it all the money. Definitely, I'm a little bit worried that you were like cutting a lot of those things. So that made me feel a little bit like, ooh, nervous. But then I saw this in here and I was like, you must not be actually cutting the money to these places. Like all of social media and the news is saying, because right here, you're saying you're going to fund it to the highest extent, to spend the most money, to get the best data, the most data. You do like the best. And I appreciate that about you. C, agencies shall work with farmers to ensure that the United States food is the healthiest, most abundant, and most affordable in the world. This also, I think, is going to make a lot of people have a sigh of relief because there's been some weird stuff with farmers lately, like the USDA and the USAID, where people are getting like all sorts of like funding not coming through for them, especially farmers. That made a lot of people nervous. So I'm sure you'll be reversing that, right? Because it seems like you want our farmers to make us food. So I'm all about that. I think that sounds great. And D, agencies shall ensure, a little tongue twister, the availability of expanded treatment options and the flexibility for health insurance coverage to provide benefits that support beneficial lifestyle changes in disease prevention. So you're going after the insurance companies, is what I'm hearing. And I think taking on the insurance companies is bold because they have a lot of money in lobbying. I think President Trump, you got $2.2 million for this last election just from insurance companies. It was less than Kamala, who got 2.6 million. Don't be embarrassed. That's still a lot of money. Is that why you're going after them? Because they gave you less money? That's fair. I do not mind petty. I really don't. But I have full confidence that you will figure out other ways to get money. You seem very good at that. So I'm thrilled that you're telling insurance companies you have to do what's best for the patient, even if it's making them less money. I think we should just jump out insurance companies altogether. But if you want to keep them, at least hold them accountable. You do it. Section 3, establishment and composition of the President's Make America Healthy Again Commission. That's why we're here, baby. Hey, there is hereby established the President's Make America Healthy Again Commission, chaired by the Secretary of Health, Human Services Chair, and the Assistant to the President for Domestic Policy serving as Executive Director. And I just want to add myself in there as an honorary member, right? Because I am helping you out here after all. B, in addition to the chair and executive director, the commission shall include the following officials or their designees. All of these people. We don't need to go over that. But there's a lot of people, so there's plenty of room for me. I would probably have more healthcare providers on here. If I'm being honest, there's like education, like all the good people who we brought in. But again, a few more healthcare providers. I volunteer. Section 4, fighting childhood chronic disease. The initial mission of the commission shall be to advise and assist the president on how to best exercise his authority to address the childhood chronic disease crisis. Therefore, the commission shall. Okay, so we're going to be focusing on kids. So we should definitely get some pediatricians in here, some public health experts too. That sounds like a great team. I'm excited. It sounds like we're focusing on children. So let's keep that in mind. A, study the scope of childhood chronic disease crisis and potential contributing causes. We talked about some of those already, right? Including the American diet, absorption of toxic material. Feels a little fear-mongering, not going to lie, with toxic material, but great. Let's do some public health, make sure people are not drinking lead in their pipes, things like that. I think you were maybe going in a different direction, but medical treatments, lifestyle, environmental factors, government policy, food production techniques, electromagnetic radiation. This is a little random. And corporate influence or cryonism. Now, I did look up cryonism because I was like, I don't know what that means. It means the appointment of friends and associates to positions of authority without proper regard to their qualifications. Ooh, RFK Jr., are you familiar with that term? Because that might have been how you got this job. Is that how you got this job? Anyway. B, advise and assist the president on informing the American people regarding the childhood chronic disease crisis using transparent and clear facts. I'm all about that with you. Let's take something that's really overwhelming, such as curing all childhood disease, and making it simple. I think we as healthcare struggle to make facts simple and straightforward. And that's led us into a lot of problems. I fully take responsibility for that. I would love to see you pairing with more people who are good at educating and breaking down information and really boosting those people's voices up and letting them be the speakers of the science. There's a lot of people that are great out there at it. Again, I have a bunch of names I could recommend if you would like any. C, provide the president government-wide recommendations on policy and strategy related to addressing the identified contributing causes of and ending childhood chronic disease. Again, I love your enthusiasm. Section 5, initial assessment and strategy for the Make America Healthy Again Commission. A, Make Our Children Healthy Again assessment. Within 100 days, the commission shall submit to the president through the chair and executive director the Make Our Children Healthy Again assessment. And I've got to tell you, I feel like this report will really accelerate that. I have not solved how to reverse all childhood chronic disease, but a lot of these things I have solved for you. So again, I think we could take that 100 days, easy, chop it in half, turn it into 50. You're welcome. Identify, I guess that's a 1. I always use bullet points and slashes, not this. But if you want to do it this way, it's totally fine. I'll learn. 1, identify and describe childhood chronic disease in America compared to other countries. This might be slightly challenging. I will know. I looked into a little bit of this, of how we compare data. Some of it's hard to get because other countries who have more of a unified health system, they can just draw data directly out of their sources. Ours is like a little bit more scattered, but I do think this would be a great thing to compare. That might take some time. Maybe 75. Let's say 75 and stay like semi-optimistic. 2, assess the threat, the potential overutilization of medication, certain food ingredients, certain chemicals, and certain other exposures posed to children with respect to chronic inflammation or other established mechanisms of disease using rigorous and transparent data, including international comparison. Never, ever against comparing and see what they're doing and what they're doing better and how we can implement it here. 3, assess the prevalence and threat posed by prescription of selective serotonin reuptake inhibitors, antipsychotics, mood stabilizers, stimulants, and weight loss drugs. This one has gotten a lot of attention on social media. You might have been tagged. I had a lot of people tag me in it to talk about it, kind of why I made this video. We do not, as healthcare providers, generally go out with pill bottles in hand, shaking them at children. If we are putting a child on a selective serotonin reuptake inhibitor, something like an antipsychotic, a mood stabilizer, we've gone through some steps. This person is not doing great. And we want them to have many life years. So sometimes starting some of these medicines is very necessary, but never ever the first thing that we go to, especially with kids. It's not in adults either, but it's never ever the first thing that we go to in kids. So I feel like this was a little bit fear-mongering and made a lot of people nervous that you were going to start taking medication away. Healthcare providers, when they provide these medications to children, assess a whole lot of risk. No one feels good about being like, hey, kiddo, you got to start some medicine. Nobody feels good about that. Just keep that in mind, that this is not something that anyone takes lightly. And we want to increase life years, right? And that's always what healthcare providers are thinking in the back of their mind when they're prescribing anyone, especially a child, medication is to extend life years. And sometimes we need medicine to do that. 4, identify and report on best practices for preventing childhood health issues, including proper nutrition and promoting healthy lifestyles. I will tell you, I have 15 minutes for well child visits. By the time I go over their developmental milestones, ask them how they're sleeping, do they brush their teeth, do they go to the eye doctor? The parent asks one question. There is no time in order to discuss health promotion and how we can improve that. So I would love if we could just increase funding in general towards primary care. This video might have been selfish for me to make because I do have a lot of requests, don't I? Increase primary care, increase access to care. If we had something that was more available, like if parents didn't have to pay to bring their kid in for a sick visit and it wasn't going to be hundreds of dollars every time, they might come back and be able to come in for all these other little conversations. Instead, we have to fit a whole year of questions into 15 minutes. And that just doesn't work. V, again, I'm going to get there. Don't you worry. We all have a lot to learn here. 5, evaluate the effectiveness of existing educational programs with regard to nutrition, physical therapy, and mental health for children. I always love when we look at how are we educating? Is it working? What can we improve? Flawless. No notes. 6, identify and evaluate existing federal programs and funding intended to prevent and treat childhood health issues for their scope and effectiveness. Great. I think we're going to need more of them from everything I've heard. Programs that are out there are usually underfunded. So I'm excited to hear you're increasing funding because there are so many federal programs that would help kids so much, right? One of the first one that pops into my head would be providing school lunch and breakfast, right? A lot of kids don't have access to that. So that would be a great way. One way you could start. 7, ensure transparency of all current data and unpublished analysis related to childhood chronic disease crisis consistent with applicable law. All about transparency, my friends, all about it. 8, evaluate the effectiveness of the current federal government childhood health data and metrics, including those from the Federal Agency Forum on Child and Family Statistics and the National Survey of Children's Health. Great. More data. Let's be open with it. 9, restore the integrity of science, including by eliminating that was a weird way to say that. I think you could eliminate the including and say restore their integrity of science by eliminating undue industry influence. Just a little edit there. Releasing findings and underlying data to the maximum extended permitted under the law and increasing methodological, that was a rough word, rigor. So again, making studies more powerful, costs more money. Hope you're ready to ante up. But again, more robust data, never, ever a bad thing. And 10, establish a framework for transparency and ethics review in industry-funded projects. Absolutely. Industry-funded projects. Exactly. If the medicine maker is the one doing the study, that should be real transparent, right? The rest of this kind of just goes about the rules. And I didn't really understand it, some of what that meant. So we won't talk about it. Thanks for reviewing that with me. Like I said, I feel like I solved a lot of it for you. There are a few things you need to go do, get some comparative data with other countries, really niche down on what they're doing better in education and healthcare. Again, I think you might find it's going to be a horse and zebra problem where a lot of this comes down to how we actually structure our healthcare that causes all these long-term effects. I'm excited for you to realize that, though. I think that's going to truly change the lives of millions and millions of people. And it's something that I have found really challenging in healthcare is how do I provide good care that I feel good about while navigating in this system that really feels like it's just trying to kill people as quickly as we possibly can, I feel. I'm on this mission with you. So hopefully it goes in a great direction. Okay. I'm here for more chats. I will be back if we need more chats. Yeah, if anybody is, if anyone else is still here, it's okay. You can speak up and let us know now. Any of you other nosy people have any comments, anything to add? Again, I know we didn't address like everything that's going on right now. There's lots of other things, but I thought focusing on this one thing, reading through it together, understanding it might be interesting. So let me know your thoughts down below. Remember, you are not alone and you are enough. Even if you're trying to do everything in the entire world in 15-minute appointment and it feels like nothing I do matters. What am I doing here? You are enough. You're doing something. You're okay. You're enough. And you, my friend, we can do hard things. Remember that. All right. Toodaloo.